Good afternoon, ladies and gentlemen. Thank you, Daniel, for the kind introduction. My name is William. I'm William Kong. I'm one of the senior consultant cardiologists at the National University Heart Centre, Singapore. So today, the title of my talk is Detecting Valvular Heart Disease. So what is heart valve disease? Heart valve disease happens if one or more of your heart valves don't work well. The heart actually has 4 valves. On the right-hand side of the heart, there are 2 valves, which are the tricuspid and the pulmonary valve. And on the left-hand side of the valve, there are mitral and aortic valve. So these valves have tissue flap that's open and closed with each heartbeat. And the flap actually makes sure that the blood flows in the right direction through your heart's 4 chambers and to the rest of your body, such as your brain, the muscles, and your lungs. However, birth defects, age-related changes like calcium depositions and degenerations, infection by microorganisms, or other conditions can cause one or more of your heart valves to be dysfunction or not open fully, or to let blood leaking back into the heart chambers. These phenomena can make your heart work much harder and affects the ability to pump blood to other vital organs of the body. So to diagnose the heart valve disease, the primary care doctors may detect a heart murmur or other signs of heart valve disease. Heart murmurs is actually a turbulent sound that the doctor can hear with their instruments. However, a cardiologist usually will diagnose this condition. A cardiologist is a doctor that specializes in diagnosing and treating heart problems. To diagnose heart valve disease, the cardiologist or your doctor will ask you about the signs and symptoms such as shortness of breath, ankle swelling, or even reduced exercise tolerance. He or she will do a physical examinations and to look at the results from the test and procedure to confirm whether a patient has heart valve disease. So during the physical examination, your doctor will listen to your heart with a stethoscope to confirm whether there's any presence or any abnormal sounds like a murmur. Your doctor will also want to find out whether you have a heart murmur that's likely caused by the heart valve problem. Your doctor will also listen to your lungs as you breathe to check for any water retentions in your lung. And the doctors will also check for any swollen ankles and other signs that your body, whether it's retaining water. So we come to the test and procedure. Echocardiography, or short-term called echo, is actually the main test for diagnosing heart valve disease. Also, an ECG or electrocardiogram or chest X-ray commonly is used to reveal certain signs of the heart valve disease. If these signs are present, echocardiography usually is done to confirm the diagnosis. Your doctor or the cardiologist also may recommend other tests or procedure if you are diagnosed with heart valve disease. For example, they might offer a cardiac catheterization, stress testing, or cardiac magnetic resonance imaging, or called cardiac MRI. These tests and procedure will help your doctors or your cardiologist to assess how severe is your condition due to the heart valve disease, so he or she can plan the treatment for your heart valve disease. Let's look at the ECG or electrocardiogram. This is a simple test to detect and record the heart electrical activities. An ECG can detect irregular heartbeats or signs of a previous heart attack. It also can show whether your heart chamber is enlarged or not. An ECG usually is done in a doctor's office or in a hospital clinic. Let's look at chest X-ray. This test can show whether certain sections of your heart are enlarged, whether you have fluid or water in your lung, or whether there's calcium depositions present in your heart. A chest X-ray will also help the doctor or the cardiologist to learn which type of the heart defect you have, how bad or how severe it is, and whether you have any other heart problem. So we come to echocardiography, or echo. It uses the sound wave to create a moving pictures of your heart as it beats. It is also a device called a transducer to place onto the surface of your chest to eject the sound wave. The transducer sends sound wave through your chest wall to the heart, and then the sound wave will be reflected back to the machine to generate pictures of the echocardiography. And then the echo actually can show the size and the shape of your heart valve or chambers, how well your heart is pumping blood, or called how good is your heart performing, whether the valve is narrow or has backflow of blood, or even leaky heart valve. So this video basically demonstrates a heart valve which is narrow and a lot of calcium depositions along the edges. So apart from echocardiography, chest X-ray, or ECG, the doctor may also recommend a transesophageal echocardiography, or we call it TEE, which is a specialized test, a semi-invasive test, to get a better image of your heart. So during the TEE, or transesophageal echocardiography, the transducer of the echo is attached to the end of the flexible tube. The tube is guided down your throat and into the esophagus, which is the swallowing passage leading from the mouth to your stomach. From there, your doctors actually can get much detailed pictures of the heart because the heart is just next to the esophagus. During the procedure, you will be given some medication, like a sedative medication, to help you to relax during the procedure. So we come to an invasive test, which is cardiac catheterizations. So during this procedure, a long, thin, flexible tube called a cardiac catheter will be inserted into the blood vessels in your arm or into your leg or neck, and then go all the way to your heart. And the doctors or the cardiologists will use the X-ray images to guide the catheter. So through the catheter, the cardiologist can do diagnostic tests and imaging to show whether there's backflow occurring through a valve and how fully the valve opens. You will be also given medication to help you to relax, like the transesophageal echocardiography, but you will be awake during the procedure. And the cardiologist may also recommend cardiac catheterization if the signs and symptoms of your heart valve disease are not in line or not in keeping with your echo results. This procedure can also help the cardiologist to assess whether your symptoms are truly due to specific heart valve problem or even coronary artery disease. All this information will help your cardiologist to decide the best strategy or the best way to give you a treatment plan. Stress testing is a simple test. During a stress testing, you will exercise to make your heart work hard and to beat fast while the heart tests and imagings are done. However, if you can't exercise, you may be given some medication to raise your heart rate during the procedure. And the stress test can show whether you have signs and symptoms of heart valve disease when your heart is working very hard. It can also help your doctors to determine the severity of your heart valve disease. So coming to the cardiac MRI, or cardiac magnetic resonance imaging. Cardiac MRI uses a powerful magnet and the radio wave to make much more detailed images of your heart compared to echo. A cardiac MRI images can confirm the information about heart defect and provides more detailed information regarding your heart defect. This information can help the doctors to plan your treatment An MRI may also be done before heart valve surgery to help the surgeon plan for the heart valve surgery. So, in conclusions, there are actually a few tests that the cardiologist will offer a patient with heart valve disease to determine whether the patient truly had heart valve disease and how bad is the heart valve disease. And with all these information gathered together, the cardiologist can prescribe a treatment plan to the patients, including heart valve surgery to correct the valve defect. Thank you very much.